Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, perinatal mental health certified, and maternal newborn nursing certified. Colic is one of the most frustrating experiences parents can go through. Today we'll be talking about everything you need to know about colic and what to do about it. So click those like and subscribe buttons and stay with us. To begin with, you need to understand what colic actually is. Colic is defined as prolonged crying 3 or more hours per day, 3 or more days per week, for 3 or more weeks. That is a lot of crying. Colic can start early in your baby's life, but it usually peaks around 6 weeks old. Colic is usually done by the time your baby reaches 3 to 4 months old. Symptoms of colic aren't just crying. This crying is different. It's intense crying like pain. This crying happens for no reason whatsoever, and it's usually at a very predictable time every single day. Most parents describe it as happening in the early afternoon to evening time. Your baby's body will be tense. They may arch their back, they'll be stiff, and they have clenched hands. Overall, they look extremely distressed, and it's for no reason at all. The question I get asked over and over is, what is causing my baby's colic anyway? And I can tell you, and the research confirms this, it has to do with all the stimulation your baby is getting. Imagine when your baby entered the world, they had never seen anything, touched anything, smelled anything, heard anything, or tasted anything. Every single day, everything they're experiencing is new. Now, in the first 1 to 2 weeks when colic isn't usually present, it makes sense because the baby is just mostly sleeping. They're still recovering from birth. But around 3 to 4 weeks, your baby does start to wake up a little bit. They start to interact with their environment. And by 6 weeks old, you find that your baby is awake a lot more than you might think. Well, imagine all of that stimulation all day long. That can be overwhelming. Put yourself into a noisy environment where everything around you is just new and loud, and you're experiencing so much at once. What often happens to us? We get a migraine. Well, the research is starting to show that babies may actually be getting headaches at that time of the day, and that may be what's causing their colic symptoms. Now, on top of that, your baby has a developing digestive system. This means that their stomach and intestines are still getting used to their job, which is to digest food. Because this is a new system, sometimes this will cause some gas and stomach pain, which also contributes to colic. And finally, when you were pregnant, you had certain hormones that needed to sustain your pregnancy. Well, some of these hormones pass to your baby across the placenta. These hormones do go away quickly, but they can also contribute to belly pain. Please remember to hit the like button and subscribe so you can get our latest content. Formula feeding is very commonly associated with colic, but just because you're breastfeeding doesn't mean you're out of the woods. Colic is also associated with breastfeeding, and if you suspect, you need to check what you're eating, what is in your diet, because what you eat goes to your baby through your milk. Some of the most common culprits that contribute to colic include chocolate, milk, and broccoli. Also, some of the medications that you are taking may affect your baby and cause colic. So you may want to speak with your doctor and see if anything you're taking might upset that little tummy. Finally, you want to look at your milk supply. If you actually have oversupply and a fast letdown, This can lead to your little one gulping down milk and gulping down air, which can contribute to their colic. You've determined that your baby has colic. Now what can you do about it? For starters, you can use a pacifier. Whether you're breast or formula feeding, pacifiers are a great way to soothe your baby in between feedings. This also helps to prevent you from overfeeding your baby if you think sucking will help your baby calm down. Probiotics are another thing you can use. You want to talk to your pediatrician about how to dose it and which probiotic to use, but these can help to correct your baby's microbiome in the stomach, which can help reduce colic symptoms. Swaddling your baby tightly helps remind them of when they were in your belly and can provide a lot of comfort and relief. Rocking your baby or bouncing them gently against your chest will also soothe your baby. Babies can often respond to white noise, so getting a white noise machine can help to calm them down. Placing your baby in the car and going on a car ride can also be very settling. Some parents use massage as a way to soothe the tummy and release some of that tension they see in their baby's body. You can also use your baby swing or a vibrating seat to help them. Finally, skin to skin is one of the most wonderful things your baby will experience with you. So have a skin to skin session followed by a warm bath, and hopefully that will calm your baby down. Colic isn't just hard on babies. It's hard on parents and caregivers. In fact, it's very hard. A baby crying for 3 hours a day is hard to take. So make sure you take breaks. It's okay to place your baby in a safe spot like a crib and walk away. Don't judge yourself for doing this. Just like the world has been overwhelming to your baby, listening to your baby cry for 3 hours can be overwhelming to you. This is just a temporary period in your baby's life. So talk to someone around you, vent a little bit. It's okay that you don't like what you're having to go through. Plus, on top of not wanting to listen to your baby cry, it can be very distressing to not be able to help them. Don't be afraid to get help for yourself. Take turns with the people around you and make sure you're doing a lot of self-care. I hope this video has helped you prepare to learn about how to help your baby with colic. Please share your comments and let us know what topics you would like to hear more about. Remember to hit that like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.